Covaxin, one of the main vaccines used in India's coronavirus immunization drive, provides only 50% protection against symptomatic Covid-19, according to a real-world study that suggests that the shot is less effective than initially thought. As India was slammed by its second major COVID wave earlier this year, researchers at AIIMS in New Delhi analyzed data from 2,714 of the hospital's health workers who were showing signs of infection and underwent RT-PCR testing between April 15th and May 15th, according to a study published by the Lancet Infectious Diseases journal. At the start of the country's vaccination campaign in January, staff of AIIMS had exclusively been offered Covaxin, a short code developed by India's state-funded health research agency and local company Bharat Biotech International Limited. Authors found that 2 weeks or more after completing a 2-dose regime, the vaccine's adjusted effectiveness against the symptomatic COVID was lowered than the 77.8% that interim results established during the final stage of testing. While various studies indicate almost all COVID vaccines show reduced effectiveness against the highly infectious Delta variant, which began its rampant spread across India in early 2021, the new research on Covaxin may dent the inoculation's appeal at a time when Bharat Biotech is scaling up the manufacturing and as India restarts overseas vaccine shipments. So far, more than 130 million doses of Covaxin have been administered in India. Bharat Biotech and the Government of India, which has widely promoted the shot, have sought to close the door on controversies involving the vaccine's early authorization in January before it had completed phase 3 human trials, prompting widespread hesitancy in the country at that time. The World Health Organization's independent technical panel also took months before granting emergency approval to Covaxin in early November, repeatedly asking Bharat Biotech for further data.